A Massachusetts hospital is now warning patients that if they don't follow its rules for a, quote, an inclusive environment, they may not get care. The offenses range from discriminatory speech to, quote, unwelcome words and bad body language. Watch.
Milford Regional Medical Center is committed to providing exceptional healthcare services to our community with dignity, compassion, and respect. Everyone should expect a safe, caring, and inclusive environment in all our spaces. Our patient and visitor code of conduct helps us meet this goal. Words or actions that are disrespectful, racist, discriminatory, hostile, or harassing are not welcome and will not be tolerated. Examples of these include offensive comments about others' race, ethnicity, accent, religion, gender, sexual orientation, or other personal traits, refusal to see a clinician or other staff member based on these personal traits. Please recognize that body language and tone of voice are also important parts of communication. If we believe you have violated our code with unwelcome words or actions, you will be given a chance to explain your point of view.
Link if you're in there, Dr. Peter. Milford Regional Hospital not only has that video, they have this policy posted on their website, quote, some violations of this code may lead to patients being asked to make other plans for their care. For serious or repeated violations, future non-emergency care and visitation rights at Milford Regional may require review, though we expect this to be rare. Kaylee, what are we in kindergarten? In a fantasy land?
I mean, I thought that the medical profession, the motto was first do no harm. So you're going to deny someone treatment because of something they said? This is absolute insanity. And I thought liberals, the big talking point when it came to Obamacare and healthcare is everyone in the country deserves the best access to care and treatment, except if you say something we don't like. And this doctor, who I loved your invitation of, Emily, he went on to say body language and tone of voice are also important parts of communication. So now if we don't like someone's tone of voice, we're not going to fix their heart? Like, no open heart surgery for you? This is insane.
You know what I thought about, Julie, as in that video was just the luxury a hospital has of judging those humans who might not know what they're doing because they are on drugs or in such intense pain, or things may fly out of their mouth that they have no idea. The whole point is, where's the compassion for care, for saving lives, and not policing the behavior?
I don't understand where this comes from. I get the whole woke, movement in this country, but you're a doctor. Why don't you just worry about fixing people and making people healthy? Because there would probably be a lot more people dying if you didn't focus so much on the political correctness that's going on behind the scenes and just treat the patients. That's what you're there to do. And that's the problem, that all these professions are just getting mucked up in politics when really people just need to stick to what they're good at. And the whole body language thing, I would be screwed.
And Tammy, how do you legally even account for the backlash? If someone dies on that operating table, heaven forbid, obviously this is a hypothetical, and they say, well, he was mean to me. How do you justify that? Everyone needs to grow up, and to Julie's point, just do your job, but it's a mess legally.
Yeah, it's a mess when it comes to the attitude. We know this is politics, right? It has nothing to do with making people feel safe. It signals that they expect people in that region going to that hospital to be so bad that they're bad people, like maybe conservatives, that they've got to be told ahead of time. Because, in normal society, in a civilization, we do have expectations of decent behavior. Right? You don't need to make a list before, if you're going to get kicked out if you come in running through the hospital naked, screaming, epithets. We know this. This is to reassess, to reassert their position. Now, if I went to their website, I searched DEI. Strangely, they might be the only company or hospital in the world that doesn't have a page about their DEI commitment.
Interesting.
They don't. Now, we know also this video, according to FoxNews.com, has now been removed or has been deleted from wherever it was posted, so that you can't see it now. And I think that these are important things, the response to this. But what it is, they don't mention the word transgender. I think when they say you can't effectively, if you refuse to see a certain doctor, I don't know, if you're a woman, you're coming in, you'd been raped, maybe you want a certain kind of doctor. A biological female, as an example. You can say,
absolutely.
And yet now, if you refuse to see this is part of their dynamic, if you refuse to see a certain clinician, out you go.
Great point.
It is still on Milford Regional Hospital's Medical Center's Facebook. The video is still on the Facebook. And Chris, this is so subjective. So what if, would my cross be deemed offensive then? As I don't ever take it off?
That's the whole thing. This is all subjective, and I think you nailed your impression of the doctor. And frankly, if tone of voice and body language are an issue, I don't know how you'd even make it through that video without falling asleep. But the reality is that this is just a policy that is in the national narrative that has gone way too far. Look, if you're in Massachusetts and you're close to another hospital, just pick another hospital. Don't deal with that garbage.
That's right. Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.